Good afternoon, everyone. It's my great pleasure to present this topic to you. Today, I'd like to talk about improving liver CT image quality and patient safety using ClariCT.AI and ClariACE. I'd like to share, before starting my presentation, here are my disclosures. And in my presentation today, I will be discussing clinical application of ClariCT.AI in reducing radiation exposure and also contrast dose reduction of the liver CT scan. To begin, first I'd like to discuss the clinical need for radiation dose reduction in CT, and then I will share the recent multi-center clinical trial of low-dose liver CT using ClariCT. And next, I will discuss potential contrast dose reduction using low kV images using ClariCT.AI. And finally, I will share the result of randomized clinical trial of double low-dose liver CT using ClariACE. First, I will acknowledging the clinical need for radiation dose reduction in CT. As you know, CT is a crucial imaging modality in body imaging, and also CT is a major source of radiation exposure in medical imaging. In this graph, you can see rapid increase of the CT number, and for example, abdominal CT scan usually consume radiation exposure of 10 to 15 millisievert. Considering background radiation from environment is 1 to 5 millisievert, if you take a single abdominal CT examination, you may have 3 to 5 times more radiation exposure compared to natural radiation exposure. Then if you got a radiation exposure, what kind of health problem you may have? This landmark study published on NEJM demonstrated that CT used from 1991 through 1996 data demonstrate that 0.4% of all cancers in the United States may be attributable to the radiation from CT studies. So there is an obvious reason of reducing radiation dose. Then if we reduce the radiation, what kind of effect is shown on CT images? As you can see here, compared to 5.1 millisievert standard dose CT images, the 3.4 millisievert and 1.7 millisievert images show much higher image noise. So on standard dose CT scan, the noise level is 13, but if you reduce the radiation dose by 30%, noise level is 16. If you reduce radiation dose by 70%, noise level increase up to 19. So the image looks uglier, and also you may not detect small lesions due to increased image noise. So reducing the radiation dose leads to the increase in image noise level and decreasing the image quality. As of now, many hospitals are using iterative reconstruction technology to reduce the image noise. And here you can see the example of MBIR, which is the most recent technique of iterative reconstruction. So here you can see the FVP reconstruction images. The 1.7 millisievert image is a relatively low dose CT exam. And you can see noise level is 19. If you use Admire, which is a Siemens MBIR technique, noise level drops down to 13. And then if you compare the MBIR low-dose CT images with the standard dose FVP images, noise level is roughly similar. But MBIR can effectively reduce image noise. It has some problems, including availability and different texture, image texture from FVP. Radiologists are relatively conservative in terms of choosing image quality. So here is an example of the patients having history of a colon cancer. Of course, colon cancer was operated, and then the patients followed up with the CT scan at a 6 months interval. One time, the patient received the CT scan, underwent the CT scan at our old scanner. We have to use FVP technique. So the 9.9 millisievert was used. Noise level was 13. And another follow-up scan was done at recent scanner. And the radiation exposure was 5.5 millisievert. And then even though radiation dose is half, noise level is 8. So it can effectively reduce image noise. However, if you compare the image quality, noise pattern is different. Image texture is different. Therefore, some radiologists do not prefer to use MBRL techniques. And also, there is another issue with the old scanners because recent MBIR techniques are not available. So if we want to use that technique, we need to change CT scanner, which is a very costly option. Compared to that, we can use alternative option, which is ClariCT.AI. It is world's first AI-powered CT denoising solution, and it is featured as a vendor-neutral software. And it works on DICOM level, so anytime you can apply this deep learning algorithm for CT images. So if you have a CT exam from other center, you may not have constantly high quality images. In this situation, you can apply ClariCT.AI because it works on image-based and also it works at DICOM level. Here is an example. We acquired these CT images. 9.9 millisievert radiation exposure was used, and then we applied the ClariCT.AI. You can see obvious reduction of image noise from 13 to 7. So basically, image texture is similar, but image noise is remarkably reduced. Up to 45% noise reduction was achieved. So based on that study, we did another retrospective study. We used the dual source CT scanner. The CT scanner have 2 tubes. A tube uses 67% radiation dose, and B tube used 33.3% radiation dose. And then we compared the low dose CT with the ClariCT.AI images with standard, the combined images using MBIR. And then we found that even we used the 33.3% radiation dose, image noise level is lower and CNR was higher. Here is an example. Compared to standard dose CT with MBIR, 33% low dose CT with the ClariCT.AI show at least equivalent image quality. So ClariCT.AI can reduce 67% of radiation dose while maintaining image quality. And also we did lesion detection comparison study, and the result was non-inferior. So lesion detectability was maintained. Based on those retrospective study results, we designed a multinational, multi-center clinical trial regarding low-dose liver CT using ClariCT.AI. So the study design would be the same. we used the low dose CT with the ClariAI. Radiation dose is 33% of standard dose CT, and the standard CT images were reconstructed with MBIR. 3 tertiary hospitals participated, 2 hospitals in South Korea and 1 center in Germany. And then we compared the noise level of the liver, and we also evaluate the diagnostic performance in detecting malignant liver tumors. So the real question is, can ClariCT.AI reduce the radiation exposure of liver CT while maintaining the diagnostic capability of detecting liver malignancy? So we used B-tube, which used 33% of radiation dose of our routine clinical radiation dose. And then we reconstructed these low-dose CT images with the ClariCT.AI, and we compared it with the standard dose MBIR images. So estimated radiation dose over 4-phase liver CT scan was standard dose was 13.5 millisievert, low dose was 4.5 millisievert. So roughly 33%. And then we recruited 300 patients, and among them, in 296 patients, we can evaluate image quality. And among 256 patients, we found focal liver lesions. So we did the liver malignant lesion detection study. When we compared the noise level was similar. Standard dose CT with MBIL noise level was 9.8, which is a decent low image noise. And low dose CT with ClariCT.AI also 9.5, so almost the same. So same image quality or slightly lower image quality. And then if you compare the images, this is the standard dose CT with the FVP and the standard dose CT with the MBIR, and then low dose CT with the ClariCT.AI. You can see the radiation dose is 33%, but noise level is similar. If you compare the image quality is also equivalent with the standard dose CT with the MBIR. And then in terms of malignant lesion detection, there were 90 patients having malignant liver lesions. And then we did a JAFROC analysis, and then we preset non-inferiority margin as a minus 0.1 in terms of non-inferiority comparison. And then all 3 readers show that non-inferiority between low-dose CT with ClariCT.AI reconstruction and standard dose CT with MBIR reconstruction. So that means in terms of detectability, malignant lesion detectability, there is no difference. So we can freely lower the radiation dose up to 66% without losing diagnostic performance of CT. So here is an example. In this 52-year-old male who has an hepatitis B infection and also HCC, if you compare both 2 images, image quality are the same. So we can say low-dose CT with the ClariCT.AI is equivalent to standard dose CT with MBIR images. Here is another example. This patient had a colon cancer liver metastasis. And if you compare both 2 image sets, image qualities are the same, non-inferior. Noise level is slightly lower. So from this multi-center clinical trial, low-dose liver CT with 33% of standard radiation dose and also ClariCT.AI reconstruction can provide a significantly lower noise than standard dose CT with MBIR, and more importantly, the diagnostic performance in detecting malignant liver tumors are maintained with low-dose CT with the ClariCT.AI reconstruction compared with the standard dose CT with MBIR. So ClariCT.AI can enhance the patient safety by reducing the radiation dose while maintaining image quality and diagnostic performance. And another issue related with the CT is contrast dose. Many patients with the chronic liver disease or liver cirrhosis may have a kidney problem. In this situation, we need to reduce the contrast dose. So we try to reduce the contrast dose by combining low KEV images with the ClariCT.AI. We all know that the virtual monoenergetic images at low monoenergetic level, like 40 to 50 keV, increase the iodine contrast. But noise level is also increased. So therefore, benefits of iodine contrast gain can be balanced out by increased noise. So we thought that if we apply ClariCT.AI algorithm to low KEV images, we can have iodine gain and also we can have noise reduction. So we did a retrospective study, and then as you can see here, ClariCT.AI reconstructed 40 keV images demonstrated superior image quality than iterative reconstruction 40 keV images or 70 keV images. And then we did a similar study among the patients with the suspected liver metastasis. And then we have a very similar result. So if we apply ClariCT.AI to the low monoenergetic images, we can have iodine contrast gain, and also we can have image noise reduction. So we can have better image quality compared with iterative reconstruction low mono images. And based on those two studies, we did randomize the clinical trial whether we can have same result from the clinical trial. RCT means patients are allocated into one of the two groups. One group is a low contrast group using 40% of reduction of contrast dose. So if standard dose patients use 100 milliliter contrast amount, low contrast dose group uses 60 ml contrast media. And then low contrast dose group CT images were reconstructed with ClariCT.AI, and standard dose group reconstructed with MBIR techniques. And here you can see the images of low contrast dose group, and compared to MBIR images, ClariCT.AI images show much better contrast in the left lobe. You can see the arrowhead, and then compared with the MBIR images, you can see the small lesions much better. And then if you compare the ClariCT.AI images of a low contrast dose group, you can see the upper row images. If you compare those images with the lower row images from the standard contrast dose group, MBIR images, image quality looks the same. So that means we can reduce the contrast dose by combination of low kV images with the ClariCT.AI. But still, we need a dual energy CT scanner in order to achieve that goal. The next aim of ClariACE is to make the same result using deep learning algorithm. So I'd like to share the recent study result at our center using ClariACE. Here you can see the clinical problems and clinical demand for reducing the contrast dose in patients with liver cirrhosis. ClariACE is a double-layered deep learning algorithm one layer is reducing radiation dose, reducing the image noise like a ClariCT.AI, and then the other algorithm is iodine boost. So this deep learning algorithm trained using a lot of dual energy CT images, including virtual non-contrast and iodine map. And then using that iodine map, we can adjust the iodine boosting from 0% to 100%. So in maximum, we can double up the iodine contrast up to 2 times over standard images. Here you can see the images of ClariACE. Left side image is original image, and right side image is ClariACE image. You can see marked improvement of contrast enhancement of the portal vein, and also aorta, and also liver lesion, which is HCC. So based on that study, we did another prospective randomized single-blind study. We divided the patients into 2 groups. One is standard contrast dose. The other group is double low dose, which means radiation dose was reduced by 20%, contrast dose reduced by 30%. And then that double low dose group, CT images were reconstructed with the ClariCT.ACE. And then according to our randomized clinical trial, the CNR and vessel conspicuity were significantly higher in double low dose group with the ClariACE compared with the standard dose with IMR. There was no significant difference in terms of detection rate of HCCs between 2 groups. So that means if you use ClariACE, you can safely reduce radiation dose and contrast dose. Here are the examples. And in the left column, standard dose IMR images. And in the middle, you can see double low dose iodine boosting ClariACE processed images. And then the right column is double low dose IMR image set. You can see that the patient's BMI is similar. And then you can see the ClariACE reconstructed double low dose CT images quite is better in terms of lesion conspicuity. So based on our experience, I can conclude that low dose liver CT using ClariCT.AI can provide lower noise and comparable detection rate compared with the standard dose CT with MBIR technique. And in addition, double low dose CT using ClariACE can improve image quality without significant impairment of detection rate of HCC compared with standard dose CT with IMR. So both ClariCT.AI and ClariACE enhance the patient's safety by reducing either radiation dose and or contrast dose while maintaining image quality and also diagnostic capability of detecting liver lesions. Thank you very much for your kind attention.